Doctors tell patients that regular mammograms are the best way to find breast cancer early, but some women may want to start asking more questions.
Jamie Yuccas shows us how one woman's story is changing the conversation for women nationwide.
Nancy Capello went for a mammogram every year for a decade.
I have no risk factors that I knew of, first-degree relapse of breast cancer, and I did my breast exams.
So she was shocked when weeks after being told her mammogram was normal, her doctor felt a lump. It was invasive breast cancer.
I don't get why the mammogram didn't find my cancer. Each of my doctors said in a nonchalant manner, "Well, Nancy, you have dense breast tissue."
More than 40% of women have dense breasts, but many are never told their type of tissue makes cancer harder to find.
The 4 different densities that we commonly see.
Dr. Regina Hooley at the Yale School of Medicine says with a mammogram, finding a tumor in a dense breast is like trying to find a snowball in a snowstorm.
The dense breast tissue appears white on the mammogram. Cancers also appear as white spots on the mammograms.
Which is why doctors may recommend a follow-up screening with ultrasound, where cancers can be easier to spot.
For high-risk patients, doctors might also recommend an MRI. It's the most sensitive test, but also the most expensive.
Supplemental screenings carry the risk of false positives, but Dr. Hooley says with experience, those errors are declining.
False positive rate has decreased by about a half.
Capello started the nonprofit Are You Dense to educate women and push for reform.
We got to do something better. We have to.
In 2009, her work led her home state of Connecticut to pass a law requiring radiologists to inform women if they have dense breasts and mention ultrasound or MRI as possible follow-ups. 24 states now have density notification laws, and a federal bill is making its way through Congress. Capello is monitored closely for any sign of cancer, and she says she's still not out of the woods.
Jamie Yuccas joins us now. Jamie, thanks so much for being here.
Thanks for having me.
So just break it down for us and tell us exactly what dense breast tissue is.
Well, there are 4 different categories of breast density, which I found very interesting. I didn't know this. It goes from fatty to very dense. And what a lot of women don't realize is that it doesn't matter what shape your breast is, what size it is. You really can't tell how dense your breast is until a radiologist looks at that mammogram. And a lot of times doctors or radiologists don't tell the patient that they have dense breast tissue.
I think that's going to be so surprising for some women. You also said that 24 states have passed density notification laws. For those states that haven't passed that kind of law yet, what is the opposition?
Well, what's interesting is that the American Cancer Society, as well as a number of professional organizations, have taken a look and said there's really no increased risk for breast cancer just because you have dense breast tissue. So an MRI and ultrasound can be very expensive for a patient because a lot of times it's not covered by insurance. And because these different medical groups aren't backing this type of legislation right now, a lot of states go, well, is it worth it?
What I'm so shocked at is that 40% of women are not told. I know that I have dense breast tissue, and I was just lucky because on my first mammogram they told me about it, but I wouldn't have known to ask. So what are doctors recommending? Do they say when you go in for your first time to talk about that?
Well, that's what was interesting in Nancy Capello's case. They had known for more than 10 years that she had dense breast tissue. She never asked the question. The doctors never told her. So she had a very small tumor that she thinks was there for a number of years, which then went from maybe a very early stage cancer to a later stage cancer in her case. And that's where she's saying these notification laws need to be out there, because if women don't know to ask the question, someone should be telling them.
Really eye-opening, this information. What can we expect to see in part 2 of your piece?
There are 4 different pieces that we've put together in our series, and my next one I find very fascinating. It's called bilateral nipple-sparing mastectomy. I didn't even know this was an option for women, and a lot of women don't know it's an option. If you have to go in for a double mastectomy, there are a certain percentage of women that are able to have reconstruction immediately following the procedure. And I talked to one woman who said it was an incredible experience for her because she wasn't able to interrupt her life. She was able to just get the mastectomy done, and 3 months later she was pregnant with her 3rd child. She was able to just move on.
It's incredible.
Yeah, the medical field, I mean, there's some breakthroughs that are happening right now, and this is one where I think it's really an important story for women to know about.
Absolutely. Jamie Yuccas, thanks so much for being here.
Thanks.